My name is Chief Hon Dennis. I'm a native of Nung Atai in Okobo local government area, Akwa State. I fell sick. Probably the medical examination identified to be a kind of stroke, which was a very serious complication since 2022, about June 2022. And I've undergone several medical attempts. I attended teaching hospital with you, private hospital, KD, so many medical outfits, just to see how far I can get out of the problem. But just this year, about precisely 11th of March 2024, one of my brothers, Ita John, came to me and said there is a medical team that go around taking charge of aged people, disabled, those who are bedridden in some ailments and several things like that. So their job is just like philanthropic. They don't charge money from anybody. Rather, they are committed to look at your problem and attempt to solve it for you. So on that day, about 11th March, they were here with me. They examined me. They took our data and some of those people who were with us. They told us their services, like when they have taken those data, they will go back and seek for the services of a doctor who will come and look at us equally and prescribe the kind of drugs or treatment that could be given to us. So that was just what happened. When they came back the second time, they gave me drugs. And those drugs were free of charge. They did not charge us anything. So they asked me to continue with that drug for a space of 1 month. That they will come back to give me the second batch of the drugs. So other people that they examined too, there were many people, numbering maybe about 20 people in series. The phase 1, phase 2, phase 3 in that my very community. They told us they are also giving the services around, like this here, like other some communities around us. They went around. But in my own particular case, the drugs they gave me was exceedingly very good. Even other people who took the drugs too, they came to testify that it was marvelous. Some who couldn't walk, some who couldn't chop, some who couldn't do 1 or 2 things like that, they were able to respond to the treatment. So even myself, it was difficult for me to sit down like this and chat or even grant any interview to anybody. But my health is picking up very well and speedily. So I thank the team. If I can benefit from a drug, that is what more than 15,000 naira at a time. Where would I have such money to go and buy it? So you see, it was a good thing. And if I alone benefited from it at that cost, what of others? And this they have given to so many people and I call that. So me now, for the past 2 years, I'm saying I have not been able to go out to do something. I'm a businessman, I'm a top politician. People in this area have known me too. But at the point, I couldn't do anything because of the kind of, ailment I have. And at that point, somebody has come up to tell you, don't worry, I'm going to get you right. I think it's a good thing. A kind of thing that I used to hear as a story, that they program somebody somewhere and say this, and it's this. So what I'm trying to do is, I just want to, don't worry, to tell you that I have not been able to handle anything in my palms, my fingers, everything was stitched. So I can stand up on my own. I can stand up on my own. I can make a walk. So that it would not be like a robot that somebody is putting there and say like this so that somebody would, no. That is why I offer to say, I can stand up, I can make a movement, I can make a walk, I can twist myself here and there. So it has not been like this. As you see me now, I'm very agile. I can do one or two things that I've not been able to do, which I believe another 1 month to come, I will be able to join the athletes. Thank you very much. You see, this is the second time I have to demonstrate to Destiny Care Healthcare that their services are very, very potent. You see, last time you people came here, you interviewed me. I was saying how potent the drugs and the treatment that was given to me were. Today is a higher improvement. I sat down that time to talk to you. And today, I have to stand by my feet and also make a movement, a kind of free movement that I did not have before. I'm just doing this to demonstrate to you that at least I am receiving, good improvement in the problem I had. The problem was stroke, was shock, was paralysis, everything compounded together. I couldn't hold something on my fingers. My fingers were just like electric cables. One couldn't touch another. And it couldn't, like it is now, I couldn't carry my finger to touch anything like this. If I approach a kind of something like this, at the distance, my finger just look like it sparks. But now I can just use it to punch the wall. And that is where I still give my appreciation and my thanks to the Destiny team. That what they have done, they have rescued me and they have rescued so many people from what they thought was the end of their life. A lot of people are yet to come and give testimony for what they have seen from Destiny Care. So that is why that day I was still telling, if government can source out people like this and give them support, because it is not easy for somebody to go to house, from house to house, to locate the sick people. You know, I came to hear a parlance that they say it is only a doctor. It is only a sick man that looks for a doctor. But today, a doctor is now looking for a sick man. Is that not marvelous? That is great, because most of these sick people, they cannot move. They don't have any assistant in their homes. They don't have anybody to take them to where they're supposed to receive services. But these people have this love to go around seeking for these people, asking where they are. And I think that has become a very great benevolence of the people. So I continue to thank the team. I continue to say, please, anything you can do to save life, please continue. God will bless you.